So how does this present in people when they come through the door? Who are we likely to see? Well, basically we're seeing from a range from young to middle-aged. Onset typically is in the 15 to 20-year-old category, but we also do see another spike later in life in the, say, 50-year-old range. And I pulled up this little Lego Adam and Eve graphic to remind you that women are actually more common than men in the population of people who are dealing with this illness. So I'm using Salvador Dali's representation of clocks to suggest that the time scale of this illness varies widely from one person to another, and there are many different categories that neurologists use to describe this illness. I think for our purposes it's important to just understand that it can vary from extremely aggressive and progressive to folks who are lucky enough to experience long-term remissions or relief from the illness. The vagueness of the symptoms, of course, can severely hamper the diagnosis of the problem. And the remissions, while a great relief for the patient, can also complicate diagnosis initially. There is, of course, diagnostic workup involved in this illness. The MRI is very helpful in certain categories. That's the MRI machine in the lower part of your screen. It's tuned to certain substances to help us evaluate these folks. And then in an EMG style of evaluation using the MRI, we can see evoked responses that are slowed or delayed because of those problems. And this is most commonly seen in vision and hearing. From the laboratory itself, we get CSF analysis that shows particular findings that are consistent with MS, including immune globulins, lymphocytes, and monocytes.